some interesting questions or people want to get hear it again. Is that all right with
Yeah,
everyone? No one objects?
that's a
Okay,
great
great.
idea.
Okay, good. All right. Okay, go ahead. So you started recording. Great. Yeah. So just a quick agenda, overview, less than 30 seconds about who we are. Then we'll get a little bit more detail about who we are towards the second half. But then immediately jump into the survey results. One of the things that you, I guess, what interests you also, what we found out. And then, of course, we're going to give you a demo of our platform. And it should all be pretty nice and casual, and should make sense and nice and easy out there. So if that's all right, let's go ahead and move to the next slide. So who is Speedster? As it says, we are a software platform, and we are specific to managing transportation options for elderly and persons with disabilities. But what we are is, and just a little one more line about it, is that we are a modern software and what they call a software as a service, SaaS platform. What that means is, well, 99% of the platforms out there and vendors out there, they built their platform in the early 2000s, so they're not using advantage of AI and automation. They haven't built a platform in a way where it's 1, 2, or 3 clicks maximum to do something, or at least 98% of what you need to do is done already. Those are the things that we've incorporated into a platform, along with a lot of other things. One of the things you'll hear me say is we are an ecosystem. An ecosystem effectively means is that we are trying to overcome the issue not only with the transportation scheduling industry, but at large, the software industry also has this where people have to buy multiple vendors, multiple softwares to do multiple things. So what we have done is we've made it into what we call a modular form, our ecosystem. So you can, whichever ones you want to turn on, you can turn on. Whichever module you don't want, features you don't want, you can turn off. So it'll be like everything from dispatch, managing your dispatch, to managing your drivers and your passengers on a daily basis, automation, AI, making things really easy, complex routing, which is included in there, so that you're using least amount of resources, saving on average, companies save about $2,000 to $3,000 with us. A mid-market company, mid-sized company would save that every month when they use our smart routing feature that we have. And then finally, reporting is what we're going to sit down and also talk about. Something I feel like everybody ignores, but is very critical part of a transportation, especially nonprofits that are looking for grants and funding and everything else from their perspective. Right. So moving into the next slide. So, we've come here to talk about this large, comprehensive survey study, but which happened in 2019 before COVID. So it's a really good one to talk about. But we noticed that in 2020, there was a lot of COVID challenges. Now, much of what is written out here, I'm speaking to the choir. I realize that you already know that there was challenges with meal delivery, where this time around you wanted to bring the meal directly to the seniors at their residence versus bring them into a senior, community center or something else. There were those problems with prescription refills. Of course, these are the over-the-counter ones, not the one where you need a doctor to actually fill out a prescription out there. How to get those to our seniors, and then there was, of course, that problem about medical appointments. How do we do it? How do we space it out in time so that because of COVID that the seniors are not at risk? How do you do it when you're transporting them inside a car that is all closed, and all those safety issues that came up. So keeping that in mind, something interesting happened yesterday. I don't know if any of you picked up on it. Yesterday on the White House website, they came out with something that is probably going to be of extreme interest to you folks in the transportation, seniors transportation space out there. And I'll read this. Typically, I don't like to read an entire thing on a slide, but I presume most of you did not probably hear about this or read about this. And it says yesterday, March 3rd, 2021, more than a dozen of Americans leading health insurance providers announced a new pilot program to get 2 million of the most vulnerable seniors vaccinated as fast as possible. Now, they're saying they call this the Vaccine Community Connectors Pilot, and the aim is to help vulnerable seniors overcome three of the most challenging current barriers. One, questions about the vaccine, but look at the second and third one, scheduling and transportation. So that kind of piqued our interest, and we started, researching this, going to the White House website. And Harsh, can you switch to that and show, and if you can blow that up because no one can see it. Yeah, just make it a little bit bigger. If you can make the percentage higher, I don't know if you can or not, so we can read it. There we go. Yes, let's highlight that paragraph that says health plans will make outbound calls. Yeah, this is the one should be of interest to you, because this is telling you that the White House is going to start funding these programs with the insurance companies. And so there's probably a good venue for you to now try and see if you can get a part of that funding. And it's essentially saying health plans will make outbound calls to unvaccinated Americans over 65 who live in areas of high social vulnerability. They will talk to them about vaccine efficacy, safety, and value of vaccination. Then they will facilitate vaccine registration and appointment scheduling for seniors. They will arrange transportation to and from a vaccination site and ensure seniors get back for a second shot. So we can close this off, Harsh. So this is just something yesterday. It wasn't a part of our PowerPoint that we were going to talk about. And I saw this and I said, wow, if you are a nonprofit, you want to get into this program and see, if you can be a part of that program, offer those things in your state, or to those, reach out to those insurance people who are offering this particular pilot. So it's called Vaccine Community Connectors Pilot. We are actually going to ourselves as a company going to investigate a little bit more about it. Should we find out more information or anything we can do, we'll be glad to send you an email and help you out on how you can enroll your organization into it. Okay. Let's see. Yeah, actually, before we start talking about the transportation survey out there, I'm just kind of curious, Beth, is that something you think would be of interest to you guys in getting involved with these folks?
There are every day.
Yeah.
There's more information, and there are some local organizations, even national organizations of college students and high school students that are working with seniors to, so there's a lot. I hadn't seen that. It is quite possible. Maryland has been in our area, has some mobile units that are going to senior housing, apartments and that kind of thing. So that's already happening. Literally, the landscape is more and more being added every single day, sometimes multiple times in one day. So, yeah. Yeah,
I'm just excited because, when the White House puts it out, there's going to be a few billions of dollars in funding in there.
Yeah, exactly.
From that perspective, I don't know if anybody else wants to chime in, if they've ever had any successes with these kind of programs when the government puts in a certain dollar amount behind it. And any of you have ever got grants or funding from the government? No? Okay. Sorry, John, were you about to say something? I saw you coming off mute.
Oh, yeah, no. The only thing is, no, I haven't applied for any grants. I know in Massachusetts, we have an annual grant period for volunteer transportation services. And I'm trying to navigate my way to see how I can qualify. What I was going to say is this is probably going to be a fairly short-term project with the White House. They're looking at trying to vaccinate everybody by the end of the summer. That's why I say it might be short term. So, of course,
yes,
it'll be an annual thing. Who knows?
No, it's that's a good observation over there. Yeah, so we'll send you this link, by the way, Beth, and everybody else, so that you have it and you don't have to go hunting on the White House website for it. Okay, so that was good piece of news over there that we picked up on. So wanted to talk to you about. So now the meat and potatoes of again, what you've come here for, and this is this massive transportation survey that we did in 2019, and it still stands. It's not like it changes every year. Well, I should take that back because it did change in 2020, but well, that's just a blip, hopefully, in all our lives, and it's just one. It'll be done in 2021. We're back to normal. Okay, so what did we do on the survey? Well, we went and hit up 150 companies and their CEOs and senior level folks to sit down and ask a whole bunch of questions around transportation scheduling, senior citizens and people with disabilities, transportation scheduling specifically. How do we manage that? And just at large, even with any kind of delivery services that we provide over there. This was a mix of nonprofits, private organizations. We also went to activity centers, specifically geared towards seniors, living communities. We also interviewed quite a bit of folks who are within a municipal city or rural organizations where they themselves offer these kind of transportation scheduling services to seniors over there. So really good size and a very diverse portfolio of people. We went and asked them, like, what's going on? What are you seeing? Whether it is not just from the behavior of the driver, the behavior of the passenger, the behavior of seniors, how you do it, but what kind of platforms did you use? What worked and work? What was all the problems they saw, and anything good that they also noticed. So having said that, let's move on to the next slide, Harsh. Right. So what I'm actually going to do at this point is I am going to let Harsh come in and talk about, I think we're going to talk about the top 3 biggest challenges. There was a lot more, but we don't want to kind of inundate this entire conversation with just the challenges. So we'll have Harsh talk about the top 3 challenges and some of the solutions that we heard people were using, and then I'll come back at the end of that session and we'll talk about a few more things. So go for it, Harsh.
Yep, cool. Thanks, Jay. And yeah, thanks everybody for joining. That was an interesting couple of minutes of introduction. So I guess let me kind of roll back a little bit into the slide deck just to talk a little bit about the 2020 COVID challenges and some of what our organizations that we work with have kind of done. And I think it's a valid one because a lot of people in first quarter, like March of 2020, were wondering what to do with your volunteer organization, what to do with the drivers, because obviously transportation had dropped around at that point. What we did see, just from kind of the anecdotal conversations we had, was that they pivoted to more of the meal delivery. So we saw a lot of meal delivery type of services being implemented. So, and that being, you pick it up at a central location and you drop it off. So that was an interesting kind of morph of their organization to sort of kind of meet this new need. Obviously, medical appointments and prescription refills are always kind of the portfolio of some of these organizations, but it just kind of accelerated now when you actually had less transportation options out there. So so we saw probably 60 to 70% of our base move to more meal delivery type of options. Obviously now what is going to happen in the next year is, all the things around vaccination, and the discussion by John, whether this is just going to be a point, 3-month kind of effort. And, there may be seniors that will do this, but in most cases, there's always kind of a bell curve. And so probably maybe 30 to 40% will kind of slowly be used to getting vaccination. So this may be more of an ongoing project in general. But those are just kind of a little bit of comments from my side. So let's go into the number one challenges. So essentially the survey was made up of about half a dozen questions. The questions were ranging from, what does your organization do? how big is your organization? And the most interesting comments we got were actually, what was your biggest challenge? And so what we're just going to talk about is the kind of the bubbling up of the top to the challenges. There were many, obviously. We have probably from a portfolio point of view, 4 different categories of organizations we deal with. Sometimes most they're going to be volunteer organizations. So you have drivers that are volunteers that are picking up passengers within the community. We also have non-emergency medical transportation companies, so more private companies that are doing kind of door-to-door service. We also have paratransit demand response organizations that are van, kind of more bus-oriented transportation providers. That's more at the city level. And then the fourth is what we kind of call the medical hospitals and clinics. And we'll talk about how that could also be an advantage to an organization as you're trying to figure out funding, because that's really the number one challenge we got, was really how to make the organization financially sustainable and where to get the funding. Now, most organizations, obviously, have different sources of funding. I would say probably 80% of our customers have some sort of a grant area where they get their money. So, and then a mixture of private funding and last, really, which is an interesting one to explore, is really how can you leverage your community in terms of funding. That doesn't mean you charge your passengers, but we've seen some interesting techniques out there to actually leverage the services that you're giving and actually make your program sustainable. So let's talk a little bit about the kind of, again, anecdotal conversations we've had with customers and what they found were good solutions to get either more funding opportunities and actually close those funding opportunities. Because I think there's 2 buckets here. It's really, like John, today you're trying to find out where the grants are, right? So that's a big big problem. Like where do you first start for that? I mean, at the very highest level, the FTA has I believe it's I'm sure Beth and Darla, you guys know this. What was the FTA program? 3210 program, I believe, where they fund cities. Those cities then fund separate organizations within the community. But that's a fairly large pool of money that's available now. Whether that's that always cycles every year in terms of greater or less. So again, kind of the challenge is how do you kind of make sustainable long-term decisions when funding is kind of variable. So anyways, what they found out is a good way. Like any funding organization, they want to know that their money is being actually used in a way that's valuable for the community that they're serving. So one of the things they've always found is quick and accurate reporting is a really good way to differentiate your organization. If you can, if the funders are asking you on a monthly, typically not, but maybe on a yearly basis, what have you done with the money we've given you? If you can show your number of rides, your number of cost per rides, your cancellations, those are all good numbers. But then if you can layer on other pieces of data like trends in terms of, I've reduced transportation costs, I've recruited more drivers in my area, I've given more rides to this part of the population, for example. Those are a little bit more detailed. So good ways to accurately kind of model the data that you're running with is important. Now, part of the challenges if you're doing spreadsheets and things like that is how do you get that data? And so what again, kind of heuristically, many tools to help you there, and talk about it a little bit later. The second one is asking for donations and/or payments from your passenger base. So I just want to talk about a very specific example. In fact, we work with the Jewish Family Services in San Diego. So they do about 36,000 rides a year. And they're a fairly large organization. And so what's interesting about their model, and not many organizations can probably replicate this, but they had actually a for-profit company that was actually providing services. And Beth, I don't know if you kind of know the story. Okay. So, and they were providing, I think it was recycling cars or something. Essentially, you give them their car and then they would sell them. But what happened is that from that operation, they actually funded their volunteer transportation program. So that was an interesting model. Again, how do you kind of operationalize that for other organizations? Hard to say. But the second and third ways they funded themselves might be more applicable. The second one was obviously grants and donors. Third one was they actually knew that their population that they served, probably 1,000, 2,000 seniors, actually probably more than that. There were some fairly capable seniors in terms of funding, in terms of actually funding their own transportation. So what they would do is at the end of the month, they would send a letter, hey, we've done 10 rides today. We're giving you 10 rides. Equivalently in the market, you'd be paying like, I don't know, $200, but they're free. If you'd like to donate, please send a check. And what they found is that, 90% wouldn't, but that 10% that did actually funded quite a bit of operation, like a lot of money. And so it's an interesting kind of strategy where, like most of the population, and rightly so, if your organization is very geared towards serving the disadvantaged, right? Typically, they won't be able to provide any kind of funding. So, but if you can kind of see if your population has some money, maybe it's that 10% that can potentially fund. So, just an interesting story there. The third thing here is again kind of relating to asking your passenger community is if you do charge. Now we've seen all the way from obviously free to flat rates to per mileage to per hour, per mileage plus per hour. So there are very many different ways to do this, and we found that none of those solutions are an end all or be all. What happens typically is you just kind of educate your passenger pool that this is the funding. This is what we're expecting. Now, for example, we had an organization that just charged $1 in UMass. Well, that's not going to fund you very much. But the whole idea was, in fact, to make sure that the cancellation rates wouldn't be high. If they're paying something, it's better than nothing. And so that was the psychology there. And they found that cancellations actually didn't, they went down once they started charging. So just kind of tactics around making sure that you're utilizing your transportation assets as well as you can, and also getting a little bit of money. So again, you have to kind of model your population, kind of have to test out, what they're willing to pay. Maybe it's just, per mileage and that's it. Or maybe it's just you're going from one neighborhood to another and it's $5, right? Again, we've seen so many different models out there. So that may be one way to kind of think about funding. A fourth one here that we've seen really interesting uptick in terms of trends is what we call coalition partners. Is if you have an asset of drivers, the question is as well, sometimes those drivers would want to do lots of rides. Like again, kind of the bell curve. You have drivers that do a couple, do very little, and then a lot, right? And so those ones that do a lot, you can actually utilize them for other services. So when we say coalition partner, the example would be that a medical office or a hospital has a lot of obviously traffic coming in from seniors, and so you go ask them, would you like to use our transportation resources? And what they can do then is say, yeah, for sure. We have a ride for Mary that we need. Can you serve that ride? And so and then you could charge them on a monthly basis. Again, we've kind of seen roll-ups on a monthly basis. We've given you medical clinic A 30 rides, cost $10. You invoice them $300 and there's a little bit of funding there. So again, trying to use your resources as much as you can to get kind of the funding. The fifth one there is an interesting one also, very kind of probably 6 months to 9 months. I don't know if anyone knows about what the great nonprofits.org is, but there are sites out there that are willing for you to go on there. You get your community to start talking about how great you are. And then they basically are trying to get people from the general community to look at that site and then start just private donor funding, right? So this is just an example. And in fact, if it's interest for anyone, we'll kind of shortlist a couple of these that we found that may be interesting for you, because if you get on there, there's a lot of visibility. There's that they pay for traffic coming to that thing, so you can get some good visibility. People most likely will be searching for, I live in Virginia. I would want to do something in Virginia, so they'll get a bunch of nonprofits, and then you could they'll kind of pick and choose, and so it's a rating system. People go in there and actually are talking about how great the service is and things like that. So 5 kind of general categories of funding techniques we've seen out there.
Yeah, I just want to some of these were really great ideas that we got through the survey. One and maybe I'm the lone one here, love to hear your opinion on this. The one which I really was excited about was the ability to set up coalition partners. So effectively what it is we're basically saying that hypothetically, if you come and license our platform or any vendor platform, but you license our platform, and if they have what we have on our platform called this coalition module, which is you now can go to these medical offices or whatever other places that typically have your seniors, your seniors visit these 2 or 3 places often, and sit down and say, we'll give you access to this platform that we licensed, but in return you have to pay us a monthly subscription fee or per ride fee. And in their case, like a medical office, they are very motivated in making sure the patients get there on time. They're also motivated in making sure that the patients are picked up on time. So it's not like you're dropping somebody and then sometimes it could be a quick 15-20 minute visit. And then now what? They have to sit in the office till they find a new transportation. So someone who waits there and all those other things out there. So, but anyways, the bottom line is when we were talking to the medical offices too, we started talking to them a little bit. They said, yeah, I mean, if we can get on a scheduling platform from these communities who have licensed the care and saying we don't mind paying them for the rides, they make substantial amount of money by having the patient in and visiting them. $10 a ride or a monthly subscription fee for X amount of rides that'll come and drop their patients over there. They have no problem, and you will see that income for yourselves, helping towards your efforts. So anybody got is it just me who's really excited about that, or do you think that is something that is viable? I don't know, Darletta or John, or anybody? Yeah, go ahead.
What I had come up with separately was thinking, why don't I go around and tap the doctors and dentists in town and say, listen, would you be willing to give me a couple of $100 for chits that would essentially cover some of the rides that might come your way? So this is another way of looking at it. I guess what you're saying is you want to approach the doctor's offices and say, listen, we've got a ride service all set up for you. If you want to direct your patients to this service, then this is what the financial arrangement is going to be. Is that what you're talking about?
Yeah, I mean, if they want to direct their patients, that's right too. That's great. Or if they have, if your clientele, so as to speak, the people who use your service go to these offices a lot, they can get a permission-based access into this platform, and they can go in there and schedule things and everything out there right away. So it just makes it easier. They don't even have to call you up or mess around with it. Everything is scheduled. It shows up on your end, and then bam, they're doing this every month. They can do it 6 months out of the. Some people are scheduling 3 months in advance. All that other stuff is available in there. So yeah, that's and they're willing to pay you substantial or and pretty penny for it at times, yeah, or a decent penny. It's a pretty, yeah.
We've actually worked with organizations in the past that have done that. So and typically it is their outreach to those medical clinics that would get them going on that. So just FYI, that's a little bit, I think as soon as you become visible in the community, you do Facebook or whatever, you may get just some interest from those medical.
Yeah, now for the rest of the audience, in our area, we've got 2 hospitals that have been giving $5,000 grants to the senior center transportation services to defray their expenses. So that's another thing, and that's I intend to go and approach them once I get this this set up.
Yeah, that's a great example. In fact, I think. It's fantastic example. And I think there's a lot of motivations from the medical clinic and the hospital side too, not the least of which is, there's an appointment that cancellations are expensive. I think that's number one, but you get actually better outcomes, right? If the patient can come consistently, dialysis, for example, then obviously that's a better thing. So they're invested in their patient community also, in the fact that better transportation is essentially better for them, and for the patient. So, okay, so let me go to the next.
Yeah, I just want to check and see if Darletta or Dave, you guys have anything that you're doing unique from a helping a funding perspective. I'd love to hear it.
We very similar. We definitely have gone after doctors' offices that we consistently take persons to. Definitely have had conversations with the hospitals in reference to partnering in. Our local hospitals already have big volunteer pools. However, they didn't have the volunteers that were willing to take them home when they're discharged. And as we know that Uber and the other groups, they tend to be curb to curb, where we would, of course, walk the persons inside, make sure that they're settled, go and pick up their prescriptions or things of that nature if needed. So we literally were in conversations with one hospital to finalize stuff, and then COVID hit. So even though we definitely have kept in contact, we're hopeful that when things resume to their new norm, that we will be able to continue those conversations. We've absolutely have been able to write mini grants and have been successful with the transportation. One of our hospitals that did have a foundation, we consistently got funds from them until it was purchased out, and they now have a new platform. So we are definitely not afraid to go out and ask the questions, but we also, and as a result of that one hospital that was purchased and changed their platform, we do charge a fee for the year, 3 acts of kindness a week for the persons. And that also includes, we have partnerships with different places to get them hot meals at no cost. I mean, so we do have a lot going on. And we do have a lot of volunteers, and we've been able to keep things going during the pandemic, where our volunteers are shopping, grocery shopping, and, to try to keep them at home. We have absolutely had some of our persons ask us, can they be reimbursed for gas? And we don't reimburse persons for gas. So years ago, AAA did, Bucks County Area Agency on Aging, they did have grant funds that could allow volunteers to get reimbursed for mileage and or gas, but right now we don't have anything in front of us. And we do get funding from the county to support the effort, but it is hard when you constantly hear all this money that goes from the lottery to support the older adults. And I go, well, where is it? How do we find it? So this has been great information, or, great conversations to have when you feel like you're in this world by yourself.
Thank you. Yeah. Go ahead, Harsh. Sorry, you were about to say something. Didn't mean.
No, I think that's echoes the number one challenge that everyone has. So yeah, it's a big thing. And I'll just kind of comment on a solution that, again, we've got a little bit of interest.
Your volume has gone down a little bit, Harsh. I don't mean to interrupt you. It's gone down. And then, of course, the F-16 is flying over your head again. So he's actually right next to the Top Gun facility in San Diego. So so he does have military aircraft and flying over from time to time.
Yeah, there's a lot of transportation going on around me. If you guys can hear me, so I think if you guys are on Facebook, if you guys are, I will hesitate. A lot of organizations kind of balk at me when I say this, but Facebook, Instagram, those things, those platforms are very viable in terms of just trying to get your kind of brand out there. And I think, finding the donors, that's a good platform to go with. And, again, if anyone wants to chat after in terms of some strategies that we've seen, we can definitely talk about it. There's definitely things that you can do there, but you just have to kind of go into the digital space a little bit more. But anyways, I'll stop with that. Okay, so let me talk. We only have, I guess, 15 minutes or so. Let me try to speed through the rest of this and hopefully show you a little bit of the platform itself. So the biggest challenge, number two biggest challenge, was recruiting drivers, and that's hopefully it kind of resonates with the audience here. So what are the things that, again, we've kind of heard what the organizations that we're dealing with are doing. Most of these are, you can kind of bucket them to the soft and the hard. I think is kind of the soft way to kind of retain and recruit, and then the kind of the more tangible way to retain and recruit. And again, your organizations have done a lot of this, so this may resonate with you. You might have some different ideas, but the one we've seen continually is making the driver feel valued through continual feedback, various communication channels, and being part of a community. I'll just give you an extreme example of one organization in Brooklyn, New York, where they every quarter will have a massive ball for their drivers. It's unbelievable. They will rent out. Now they have a lot of money, I think, but it's really interesting that they will just make sure that every driver feels really, really welcome. And the output of that is that they do real-time driving. There's no schedule. So if someone calls in, like right away, they will have a volunteer driver go pick them up. And that's how much, if you could get that driver community to feel really valued, that you could get really interesting behaviors from and these are all volunteers. You're not paid. There's no reimbursement at all to any of these drivers. So that's an extreme, and you need the funding to kind of make sure that happens. But I think that the lesson generally I've heard is the more you can kind of give tidbits of communication back to the driver, you get a feedback from a passenger said that ride was great. If you can somehow get that information to the driver, it's a really, really interesting way to kind of retain those drivers and eventually maybe get more services, and again, if that's the goal. So the second one here is make it easier for drivers to manage their schedule. Essentially, there are programs we've seen where drivers give the schedule and then they say, I'm available from 9 to 12. I'm going to be booked from 9 to 12. That's all the time I've seen. On the other hand, I've seen organizations where it's essentially real time. So it's like the Brooklyn case. So the way the drivers want to be managed varies extremely. So they would want either real time or they want to be very planned. And so in both cases, you want to give the tools to the drivers for them to basically decide how they want to kind of choose rides, take rides, etc. How to cancel rides, how do you manage cancel rides? So again, kind of communication tools and ways to give the driver tools beyond the website. Now, kind of what Jay told earlier, most of the technology we've seen out there are based on kind of web-based technology. We are, but we're also very focused on mobile. 80% of many people are doing kind of transactional work, like looking for rides, is going to be on their mobile phone. Now you could argue that most drivers are older, for sure, 100%. But again, the trend is going up. We've seen even this year, there's a famous, I don't know if anyone knows this, it's a tech company, but they've seen, before they would see no support requests digitally from this group of 65 and over. This year, because of COVID, they actually saw a 70% increase in digital requests. So you could see that more seniors are going onto these platforms by necessity. COVID's kind of accelerated a lot of this digital only thing. And so by default, a lot of seniors are moving towards that area. So again, if the drivers are mobile, they can see the rides, they can see cancellations, they can communicate seamlessly. You're working on the driver's schedule. So that's another thing we've seen out there. The third thing here is incentivizing drivers through various rewards and payout schemes. Again, we talked about from mileage reimbursement to gift cards, all sorts of different ways to reimburse the driver for their time and their effort. Again, making a big ball is another way to do it. So I'll just stop there. If there's any comments or questions on kind of driver recruitment and retention. I think that's a big one to crack, and it's a hard one to crack. So. Okay, so let me move on. The third biggest challenge, sorry, Darletta, did you want to?
Just going to comment, we definitely, I think we're pretty good at recruiting volunteers and retaining them. As you noted, age-wise, most of our persons are retired. Most of our persons are from churches. We definitely have built church teams and also trying to get them to take their own members and definitely building within the community. During the pandemic, because of, persons working from home, this is the most we've ever had of younger adults that have been volunteering with us. Because it could be at their own schedule, whether they were going grocery shopping and delivering or picking up from a food pantry and just dropping off. So the commitment level was much shorter because they could fit it into just doing something in an hour, if you will, as opposed to a doctor's appointment that could be time consuming. And our Saturdays, historically, we've never done Saturdays, but we have big meal deliveries on Saturday. About 150 people get meals every Saturday. And our young, I have to say, 40 and below, they're bringing their kids. They've incorporated into their family lifestyle. Kids doing something to support the efforts. So it just wasn't about one group, just delivering a meal. The kids might be making cards. So during the pandemic, definitely it's been a little bit different. We hope that we can retain them as, we go back to our new norm. Definitely our time schedules going into the evening and doing different things in the evening and allowing them to make it their schedule has made it easier for us for the first time, where when we go back to the new norm and those doctor's appointments are during the day and they're working, we know we won't have that, but other projects we've opened up to do so much more. So.
Fascinating. Yeah, that's a really interesting point that the younger, because it's always been historically hard when I was talking to organizations about how to get younger people involved, and this is kind of a perfect opportunity. So that's great. Thank you for that.
Yeah, I'll take over this slide here. That's interesting. And, with younger people, I guess that was a great segue out there, using the proper technology. And we know that they can at least, if your volunteer force is young, the technology part of it, they're a little bit more adept towards it. But what we heard in this, the third most important thing is the technology is from the 2000s. As I said before, it doesn't have AI, automation. It is disjointed. It is, I need one vendor, one software platform to manage my dispatch. I need another one for, as I said, the driver, the passenger. Even if there is a software, it's really not, it's very complicated, or it doesn't offer you the configurability of where you can do these complex combinations of rides with drivers, with passengers in there, because we heard quite often that sometimes the senior prefers a certain driver, and so the matchmaking also service needs to be in there. The other problem that we heard was the routing issue was there, and where that used to cost them a lot, like trying to have multiple routes, really done well in a way that you are saving the most. We all heard the story of UPS, how, when their trucks go, they're very to a particular route. So and the way I think, what is it? They make only left turns, or they'll make I think they make only left turns or something like that, as much as possible to avoid the longer period of time and be a little bit more smarter. And then, of course, the reporting becomes important. We talked about the government sitting down and helping, with funding, but what do they need in return? They need extensive reporting. When you go and ask for funding from anybody, the grants, they want to know, what are the kind of reporting can you give me back? And the reporting is not only how many rides you did and how much miles it was, and just a rudimentary thing. They want to understand behavior. What time of the year does your routes go up? Which are the most, which age group tends to go to what kind of routes? Like, they tend to go more towards medical offices, yada yada, and all that other stuff. And those complexities in routing, none of the platforms are providing it right now, because they've almost looked at it as an afterthought, like, let's just give them something common. So you're going to see a demo real quick. I know we got 5 minutes left out here, so let me hand it over to Harsh. We're going to continue this. If you got a few more minutes, beyond 5 minutes, it'll be great. But we're going to show you where we built our platform, listening to all these responses, and how we use that AI and automation and brought all these things together on an ecosystem. And I'm a big proponent of AI simply because, boy, people do the same things over and over again. Why can't the system just learn it instead of me always having to do the same stuff over and over again? And so that's what we incorporate into ours. So, Harsh, why don't you jump into it? And I think we ran a little bit late than what we wanted, but like, let's do it.
Yeah, so I'm just gonna touch on this this one slide. If you guys want to, you can read it. But it's interesting just from a kind of an operational point of view. I think the third bullet's interesting. 20% of the driver pool gave 80% of the rides. So it's really about making sure that that 20% is really taken care of well. That's what we've heard back from our community. Okay, so we're just gonna talk. I think the best way to think about what we do is essentially what Jay said. So we have different components of the system that we offer, and I think scheduling is obviously the number one thing that from a transportation perspective makes sense. What we do offer is multiple ways to schedule. It's not only just kind of assigning a driver, broadcasting a driver, but you can actually do calendar-based scheduling. So again, kind of allocating specific driver's time and getting calendar views. So it's a little bit more visual, our platform in terms of that. What that means for you from a scheduling or dispatch point of view, you can see where the holes are. So you can visually see, okay, there's a 2-hour window here where maybe I can schedule some more things, essentially try to optimize the resource. Smart routing, we have 3 different types of routing. We kind of made this kind of accelerated one of our modules for the COVID. So food delivery is how do you give someone 5 packages and what's the most optimal route for that person to drop off the package for the different seniors. So we got that. We do multiple drop-offs and pickups. So you may have 20 rides in a day. You might have a 12-person bus. How do you efficiently do pickups and drop-offs throughout the day? And so we've had anecdotal data coming back that from our reports that we could save between 30% in fuel time. So bigger organizations, a little bit more bigger, but they have buses and that sort of thing. So that's our smart routing module. Ride accounting. So again, if you do charge or if you do think about passenger payments, we have an end-to-end solution around that. Reporting, we talk very important. So we have 30 plus one-click reports. There's no going into Excel and pivoting and trying to figure out the best way to get your data. We have all that kind of one click. Mapping and GPS, again, just to make it more efficient on the driver's side. Where's the passenger? What's my ETA? How long it's going to take? Is there traffic conditions? How can I call the user? We have various communication channels all the way from SMS, voicemail, email, and all built into the app. Virtualized communications, this is something we just launched this year. This is a way for you to have, if you have multiple dispatchers and you want to have one central phone number, how do you essentially route that call to those dispatchers so you're not like actually at a physical location? Because of COVID, that's the big issue. You can't go to an office. But some organizations have told us essentially if they didn't have the capability for the dispatchers to work from home, they would have had to shut down. So a lot of this stuff is about how do you decentralize your phone system. We have what's called visual voicemail. So if a passenger leaves a voice message, we transcribe that. That's going to be email. So it's a lot more asynchronous rather than synchronous calls. If your passenger pool like that, that's also one of the modules we have. I'm not going to talk about too much about the actual demo, but I would encourage you guys, if you guys want, you can go to the website, go to spedsta.com. You can click on any of these modules here, and there's about 1 minute to 2 minute videos for all what I've just talked about. So scheduling intelligence, reporting and analytics, the virtualized phone system, the smart routing systems, and the payment and accounting. What we didn't talk about is if you do have legacy systems, we do have as part of the setup data migration tools. So if you have spreadsheets of data, if you have databases of data, we can all move that over to Spedsta without an issue. So we feel that's a little bit of an issue with, but if you guys want to if you guys who have spreadsheets or data, we can definitely work with you on making sure that data is put into Spedsta without any worry at all on your side. So I'm gonna kind of stop there, unless anyone wants to see anything specific.
Yeah, actually, what I'd also like to offer is that we are happy to do a personalized demo for you. There is a lot in this platform, the capabilities, as I said, the automation, the AI, and everything else it does, which because we've gone over time, we don't, we want to respect your time. We'll be happy to do a personalized demo. But even from a scheduling perspective, when you sit down and really think about it, the complexities would be, I've got a volunteer force. How do I sit down and make sure not only can the driver sit down and pick and choose, but what happens if someone in last minute cancels from a driver perspective to, I've got a driver force where it's not volunteer, I got to pay them, but I got to pay them in different ways, to where it is a volunteer force, but I can give them some gift cards or something else, as an incentive, all of those things. And then all that reporting and the behavior from a driver's perspective, and you get. And similarly, from a passenger's perspective, it's just really in-depth, complex things that we are able to sit down and do this. And when you on board with us, we set this up for you. So it's not like we're going to sit down and say, thank you very much for licensing this platform. You have it. And there'll be one more question I'm sure everybody wants to know. What does it cost on it? So the cost, I would say, is anywhere between $50 a month to $200 a month, depending on the size and scope and all the different modules that you need. So happy to take some questions right now. Or if you folks have another 5 minutes out there, we'll be happy to show you more of the demo.
I'm so sorry. It's Starletta. I have to log on to another Zoom meeting. So
Sure.
hopefully you will have another session. Definitely would like to learn more, because this is really why I wanted to hear more, but I'm facilitating the Zoom meeting, so I do have to go. But it was nice hearing and meeting everyone. If you want to schedule, shoot me an email, or I could shoot you an email for additional questions, I could do that, because I do have
Yeah,
some.
and we'll be happy to schedule a one-on-one demo for you and go in much more in depth. And that's for everybody. We can do that too. But we're happy to take any kind of questions right now. Anyways, thanks, Darla. We really appreciate you joining. Cheers.
Thank you, Darlene.
Yeah,
I'm gonna jump off because I've got to get into another meeting. But actually, this was really helpful, and I don't know where we're gonna lead, but I've taken copious notes, and if we're gonna be in this business, which is still an if right now, I'll definitely pursue getting in touch with you. So thank you.
Absolutely, Beth. From our perspective, we'll be happy to do a demo to your team, just so that they know that should they move in the direction of whether paid or not paid, here is a platform that is going to certainly ease it for us.
Sure.
Even from a payment perspective, all the combinations that we put in there inside the platform itself, we build it out for you, makes it far easier, because it's one decision whether you want to go for profit. The other one will go like, how do we start paying people? What is the process? How do we measure this? All this other stuff. So we'll be happy to at least give you that heads up
Thank
and show
you.
you that demo. Cheers.
Great. Appreciate it. Bye-bye.
Yeah, absolutely.
anyway, I'm interested in seeing the demos. That's one of the principal reasons I came on today. Although the information you provided is very helpful. I'm just beginning to get the implementation part started. I've actually been through some of your demos. The only problem is the quality of the visuals on your website leaves a lot to be desired. In other words, it's kind of fuzzy. The second thing is that some of them were obviously supposed to have communications, in other words, voiceover, but the demos didn't have any voiceover.
Yeah, John. Yeah, they're actually muted voiceover, just to kind of give you an idea of the platform. But I'd be happy to, if depending on your time, we could give you a quick demo right now.
Sure, go ahead.
Okay.
Yeah.
Okay.
Yeah,
All right.
Dave, you okay with that? If you're not, we'll be happy to do one. Just reach
Yeah,
out to you.
no
Do you want to have?
problem. I'll stay for a few minutes.
Okay, let's do it then. One of the interesting things while Harsh is setting this up, John, what you saw a year ago, it has been a sea change in what we've done to the platform. While COVID was going on, we had more time to sit down and get better on our back end and on
Yeah.
our platform because we didn't have that many customers, to be honest. Everybody was hit with this, so we spent our time on that. So go for it, Harsh. Let's do a actual demo thing here. Cheers.
Okay, okay, thank you. Okay, so I'll just kind of go from an admin point of view. In fact, let me.
You have to make this a little bit bigger, I think. I don't know if can everybody see this or is it too small?
I
Or it's just me?
just increased my screen size myself here, but I,
Okay.
Okay.
All right.
Let me talk about a little bit of the roles that can kind of give you context about how the platform works. So there are a number of different roles within the system. When I say roles, that these are specific login credentials of Dispensa, and they will have different access to tools. So the administrator, if you sign up actually right now, if you sign up for free trial, that will be the account role that you'd have. You'd have an administrator role, and within that role, you have basically access to everything in terms of configuring your current account. The dispatcher has a little bit less credentials. So the whole idea here is that if you just want them to book, cancel, manage rides, that's good. They have other settings in there where they can kind of add and delete passengers, but they won't have access to the ride accounting module, for example. They won't have access to notifications and custom settings. So those are different settings within your power as an administrator. Obviously, there's a driver and vehicle login. So those drivers log into the system, they see available rides, they see the booking rides, they can cancel, they can message, they can change rides, they can request different things from the dispatcher and or passenger. So that's another role. Passenger obviously is another role. So if you book on behalf of a passenger, they can log in and see their logs again, different settings for them. A partner is what we talked about, medical facility, medical clinic. So those guys have, again, a different type of portal because they go in, they actually book on behalf of their passengers. So they have a list of passengers that are associated with their account. So they can do various things there. And then the last one here is the caregiver. So just to kind of give you, and we won't be able to do this, this is, just to give you context, if and when a sign up happens, in terms of accounting, this is probably 4 to 5 hours of training just on the admin side, and then separate training for the 4 or 5 hours total. So including dispatcher, passenger, and admin training. So we'll just try to speed through that. So what you see here is essentially the admin page. So you'll see a number of different tools here, all the way down the side here. I think that the most relevant ones are going to be adding passengers and adding drivers. That'll be the first kind of step. And once you have a passenger and a driver, then you can start booking rides. Then probably the third most important part is getting into the settings and then the reports. Those are probably the top 3 or 4 settings you want to go into. Things here are additional modules that we can talk about if it makes sense. The smart routing that we talked about, adding organization, different driver scheduling tools, but the basics is right here, up here, and basically down. So essentially, and that's actually the fourth one here, as I'll just talk about quickly, is what we call the virtualized dispatch system. So it's a complete phone system we've built up. Your organization can have your own phone number, multiple extensions, forwarding to different people, different voicemails, greetings, etc. So this is all baked into Dispensa. You have one platform to log in, do all your phone dispatch, and also all your digital dispatch, I guess if you want to call it. So this is all the settings there. Again, talk about that later, but this is the settings there. So let me quickly kind of show you how, if we have a passenger and if you have a driver in the system, let's just book a ride. So a call comes in, we're just going to go here and book a ride. You'll see a couple of things come up here. You select the passenger driver, select the drop off and time, pretty standard. So within that system, you have 3 types of a couple of different variables here. So we're just going to select for a member here, Betty Boop, for example, and then we're going to assign, or you could so there's three ways to assign drives. One is you can broadcast it to a driver. So they're just volunteers. They see a ride pop up and they can accept it. You could broadcast to none. So the broadcast to none is essentially you don't want that ride to go out. You want to route it. So you don't do anything until you route it. And then the third step is you can actually assign it to a driver. So we're just going to assign it to a driver. You can assign it to a vehicle. You can assign trip type. So the whole idea here is you can get more data and then some messages about that particular drive. Now, nearest driver is another larger feature within the system, but it's essentially a way to understand where that driver is located relative to the ride. So again, you're kind of optimizing things here a little bit after you select
Oh, I see what you're saying. Yep.
Yeah, and in fact, it's an interesting one because, anyways, we can go offline with that. But when you do a routing scenario, you might want to figure out the best ride for that particular routing. So when I say routing, there's a pickup, drop off, blah, 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 right? You may have a dynamic, someone calls you the day of and says, oh, I want to ride today, but you've already routed your drivers. We can actually now insert dynamic rides into those routes so you can have dynamic changes within the sequence. We won't go through that, but that's just kind of another feature there. So pickups and drop-offs, there's a couple of ways to do it. There's our favorites. So these are favorites programmed by yourself. So there's always a home address there just for quick kind of booking. You can collect their home. You can then put drop-offs. So we have a number of different common drop-offs like church, dinner, clothing, etc. So we're just going to make a random selection there. We'll calculate kind of the distance. We'll put in different aspects of the time. So obviously the pickup time is number one. If you want to do a return trip, you can. You can actually select different drivers or different ways to handle that return trip. So for example, some organizations have drivers that work in the morning and some that work at the night or the afternoon. So you may want to split up the return and outbound trips. You could set appointment times here. So the whole idea is that you may be picked up at 1, but the appointment time's at 1:30. That's the way to communicate to the driver what's going on. You can set up weekly schedules. So, 52 weeks in advance, you can set up a Wednesday recurring one with a couple clicks. So there's not much effort to do that every day. Kind of the example is dialysis. Dialysis patients are very regular, so this is the way to kind of do their regular trips. You can add stops. So if there's a stop in between that the senior wants to do, you can definitely do that. You can add that here, and you can set waiting time. So if you want to, let's say the driver's going to take the passenger and wait, then you can also tell them how long they're going to wait, so they have an idea of the wait time. Okay, so we're not going to do any of this. We're just going to kind of.
Harsh, I got a question for you. How do you handle, I've often gone to the doctor and all of a sudden they want to have me administer a test. I'm thinking I'm only going to be there half an hour and all of a sudden it's going to be an hour and 15 minutes. How would you handle that in this situation?
Yeah, so we've seen there are many different ways organizations handle it. So I guess that's the one answer, but I'll tell you a couple ways that they handle it. One is they can, I guess from a software perspective, you can always communicate as a passenger. You can always communicate to the driver and or the dispatcher.
Oh, okay. That you're going to be delayed. Yeah.
Exactly. Yeah, and we have different ways, and I'll show you that right now. Actually, now that you've kind of mentioned that, let me go into that. I'll just book the ride.
So you have essentially like a Waze kind of roadmap for them.
Wait, WAZE, Waze, is that what you?
Yeah, like the people we use in our own cars.
Right. Actually, we use Google services. So
okay.
Most of what you're going to see here is because we can't really understand. They're the best at traffic and mapping, I think, in general. So we just kind of use their services in our back end.
I see.
But let me show you how the communication happens. So just now, if you can visualize your passenger, you log on, you see your ride, you'll see this kind of information here. So there's many different ways you can communicate. Say, I am going to be late, right? You can just kind of put that there, and you can send this out to the driver, to the dispatcher, etc. and depending upon what organization, what modules you buy, email is always going to be part of the package, but you can also send SMS and voice message. So if the driver has a phone, they'll get a SMS right away saying, "Oh, I'm
Okay.
gonna be late."
That's good.
Right. So, yeah, so we're all very real time. All this is very geared towards making sure that everybody's using their time most efficiently. Okay, so let me just kind of go through this a little bit more. Again, from a driver perspective, sometimes you have dropped off you're on your way to pick up the passenger, and you could do what we call a driver ETA to pick up. So we'll calculate the best time, and then we'll send that message to the passenger. So again, they can do it via voice message, so they can actually have a home phone. You dial, they ring, and they'll hear, "Oh, the driver's on its way. The ETA is 10 minutes." So that's all automated within the system.
I see.
Every one of these links goes to Google, so this one will actually open up the Google Maps, and you'll get turn-by-turn directions all the way there. So the whole idea here is the best communication platform is what we're trying to build here, and we've got every channel you can because everyone has ways to communicate. So let me go back to the dashboard here just to show you a little bit more how that works. And there are nuances here just to kind of be clear. So you can modify this ride. That's the rule of transportation. Everything changes. So you can modify everything about this ride. You can cancel drivers, passengers, change time, change pickups, etc. You could cancel that ride. So what happens here is that the ride is canceled, the driver gets notification, and then they don't have to be worried about picking up that particular passenger. All the cancel reasons. This is for data purposes, reporting purposes. You can see all the different ways you can cancel and report on the drivers. Okay, so you have here what's called, now all these colors show you the state of the ride. So essentially anything in green has been done, it's been booked. Anything in light blue is like, okay, it's still open, it's still requested, passengers haven't, or drivers haven't picked it up. So there are many, many ways for a dispatcher to manage this page. They can go and filter on any of the states of the ride. They can select different passengers. They can select different drivers and just try to visualize actually what's going on with the ride schedule. They can go into what we call a calendar view. So you can see very quickly what's going on every day of the week or the weekend, for example. That's all part of the options here. I won't go into too much, but the end ride may be important to you guys. So what this happens, so the driver drops off the passenger, there's an end ride button that comes up here. You can then put in data. For example, were there any comments about the ride? Was there any payments received? Was there any kind of chit given? As you mentioned, right? You want to kind of give chits to the passengers. We've seen that happen, and so we actually put in. This is all customizable. So as you build out your payment system, we can make this kind of custom to chits or $5 tokens or however you want to kind of capture that payment. Okay, so that's really the booking side of it. I can go into the passenger profiles and things like that, but I just want to stop. Is there any kind of questions there?
No, yeah, I was just as I recall from a year ago or so when I saw the demo, you have the ability to have, like family members fill a kitty full of money, and that the passengers can draw down an account.
Correct. Yeah. So we've kind of modified that a little bit, but the system remains the same. But now we have it all the way end to end. So, for example, right now, what you do for every ride is you can set up a pricing profile. So let's say it's $5 flat rate, right?
Yeah.
So what you have here is, let's say, you can communicate that to the passenger. Okay, you have for example, this one is, it's going to cost you $10. So then what you could do is you can actually go into that member's financial statement and see what their level is for their money. So right now, Betty Boop has a balance of $94. So she's okay to take that ride because you can give that money to her, or that she has that money. You can add deposits, you can create withdrawals. So there's a whole ride accounting system here that you can kind of manage.
How does that? Have you dealt? I've forgotten the term where they use, build it, handle a credit card facility with someone, a relative of a passenger wants to be able to use their credit cards to put money in the account and so on.
What you could do there is, we have credit card processing facility on payment. So let me just show you how that works. So passenger ride history. So I'm going to go there. I'm going to search for any members that favorite rides. And then, for example, right now, Betty Boop has this ride. It's $16.92. I'm just going to select that, save the changes in email. Now, what we do here is that you can do a couple things in terms of that ride account. You can create a debit charge against the account. Essentially, what you
I
saw
see.
before, you'll just charge it. But you can also charge a credit card. Now, this is grayed out because there's no credit card associated with that person. So
Right.
if there's a credit card, you can automatically charge it there. We get the transaction number, we populate the report, and then it's done. So that's the way you can handle credit cards. Okay. Yeah.
Is there an additional fee? I know I worked with Fort Worth Public Schools for a bus transportation system. And they wanted the ability to have, parents fill a payment facilities. There was some additional cost by dealing with the credit card companies. Are you handling that interface, or is there?
So what we need to do is there's a one-time setup charge for that. So I think it's $500 to kind of set up the back end.
Yeah.
You would have your own back end. So we would recommend our we've integrated it to Stripe essentially. So you would get a Stripe account, and then you would handle all your transactions via that portal. We wouldn't be doing anything more than charging through our interface here to your Stripe portal, and then all the money goes to you. There's no actual money that we retain. It's just all record keeping on our side.
Yeah.
Okay, yeah, if you have any specific questions, maybe that's the best way to kind of handle, if you want. There's a lot here, so I don't want to kind of overwhelm the conversation now.
What's the next module you recommend looking at?
We talked about the booking. We talked
Yep.
about the financial model. There's routing modules here, so the whole the
I
idea
can
of those.
see that you've really just the way you talked about the different modules, you've got a lot of capabilities built into the system. I hadn't thought about the delivery kinds of things. We have Meals on Wheels, which is operated out of the senior center. That right now is handled separately, but I can see how that might possibly be could become part of this. But also the thought occurred to me that there might be homebound people that need shopping done. It seems like maybe some of the volunteers might want to go do shopping for seniors and then deliver that stuff off.
100%. No, we've had customers do that. Yeah, they're using our system for all of that. So
Yeah, I have a question. Do you happen to have anybody, any of the customers in New England, or at least ideally it would be Massachusetts, but are there any in neighboring states?
Oh, definitely. I don't know if in Massachusetts that we have any. I'll have to look and see. But in the Northeast, we have a couple. We have a couple customers in the Northeast. So yeah, definitely. We can give you references or whatever.
Sure. Yeah. No, I'm just trying to get a better sense of how they went about selling the whole program to their customer base.
Yeah, understood. Yeah, I wouldn't say it's easy. A lot of these organizations are years and years, or like tens of years old, some of them. So they've built up a lot of trust in the community, and that's what I've seen is kind of the most successful ones. Just build it up very slowly, which
Sure,
I'm sure you're
sure.
John. Yeah.
Okay. I've gotten a pretty good feel. Obviously, just that one module, you've got a lot of sophistication built into it. and I'll be interested in, and is there online documentation that would allow me to get a better sense of some of the other?
Yeah, absolutely. Yeah, once you sign up, I don't know if you signed up for a trial a year ago. But
No,
you
I
still have-
didn't, because it was premature. I still actually, Harsh, I still have to find a home for this system.
Yeah.
Meaning,
understood.
and I'm meeting with the town manager tomorrow to try and see if I can resolve that a little bit. In other words, the senior center believes they're in the senior center business, but they don't believe they're in the transportation business. And
Right.
I want them to think more broadly.
Do they do transportation right now, that senior center?
Yes, they do, with, 12-seater, 14-seater vans. They have 3 of them,
Okay.
but they don't do a lot of point-to-point work. And that's what I really think there's a pent-up demand for.
Right. Yeah, so just FYI, I mean, obviously the platform integrates all those. So if they're doing multi-bus routing, and you want to do point to point, this is all kind of all baked in. So maybe there's a partnership opportunity where,
I see, sure.
yeah, where you say, hey, you know what, I can.
Yeah, I
here's
mean,
the
well,
platform.
they have a small but very meaningful senior daycare. And so they do, they send their vans out and do a bunch of pickups and bring them all into the central place for 9 o'clock, and then they return them home at 3 every day. So that's one of the things. And then they also bring people, they do a round robin, like a route to pick up people, seniors for, just normal activities, games and seminars and fun and, spending time at the senior center. They do that too.
Right.
And then,
right.
and then, oh, by the way, if they have any leftover space or time with their vans, they can then go point to point. And that's the problem I'm trying to solve, because with over 9,000 seniors in town now, not all of them, most of them drive, but I'm thinking there's at least 500 of them that don't. And they are underserved, I'm sure.
Yeah, it's as I think about, let me think about your scenario, and maybe I could give you some case studies that I've seen that has worked in your, because it's a very specific, right? You try to go sell a senior center, and then they obviously have their own like kind of agenda and priorities and things like that.
Yeah, exactly. Yeah.
No, it's a little bit of a slow moving thing, but if you're interested, yeah, if you want to go to sign up for the free trial right here, that's where you go. And then once you're in the free trial, if you want to see all the help videos, we have about 30 help videos here, and you'll get all the data.
Yeah.
And this is a little more high resolution, by the way, so you'll be able to see everything clearly, and there's actual voiceover and things like that, so
Yeah.
you'll be able to get.
Oh, that's really great.
Yeah, that's
So you essentially got single concept tutorials here.
Yep, exactly.
Yeah.
So just feel free to sign up for the
So
free trial.
if I were to sign up for a free trial, even though I may not have the thing sold yet, I can, there's no harm, no foul. I can just learn about the system and so on.
Yeah, 100%. Yeah,
Yeah.
It's 30 days. I mean, it's automatically like turned off unless we keep it on. But if you feel that you need more time, then
Yeah. Well, I'm going to have a committee working with me, and I'm sure I'm going to be wanting them to have access to.
Cool. All right, very good.
But I mean, the price, in my mind, that the pricing is very fair. I was going to budget $2,400 a year in my straw budget, which looks like I could pick up everything. So.
Right. Yeah. No, that's well within kind of our wheelhouse for the basic.
Well, we're a small organization, but I'd want to be able to accomplish everything through the software.
Yeah. Oh, we're on the same page. We'll make it work for you, John.
Okay.
Okay.
Well, thank you very much. This has been very helpful.
Awesome. Yeah. No, thank you for joining, John. We appreciate it. All right.
Okay. Well, we'll be in touch.
Awesome. Great. Have a good one.
Yeah.
Cheers.